know this, but up until a generation or two ago, women with type 1 diabetes were often advised to avoid getting pregnant and having children because of the health risks, both to mom and baby.
News 9's Robin Marsh shares new findings in today's Medical Minute.
1.6 million Americans are living with type 1 diabetes, and many are young women in their childbearing years. Now, luckily, medical advances have made it safe for these women to have families, but there has to be some careful planning. For 25-year-old Elon Barnes, little Robert is the center of her world. But when Barnes was first pregnant, she knew she'd have to work hard for his health and her own. That's because Barnes was diagnosed with type 1 diabetes 10 years ago.
I had actually just learned about diabetes in my high school biology class.
With type 1 diabetes, the pancreas produces little or no insulin, and patients can have blurry vision, frequent urination, and extreme thirst. Diabetes specialist Dr. Rachel Oxman says it's important for women to begin planning before they become pregnant.
The first trimester is a really tricky period in the pregnancy. That's when baby's forming all of their organs, and we want baby to have a healthy spine and healthy heart, and diabetes control directly contributes to these things.
The doctor says patients should have an A1C or average blood sugar level of 6.5% or lower during the first trimester. She goes on to say that women should not be afraid to take their insulin.
It doesn't cross the placenta, it doesn't get to baby.
Barnes also used a continuous glucose monitor to keep a watchful eye on her blood sugar.
I had to be a very well-behaved diabetic, to say the least.
Dr. Oxman says it's also critical for new moms with type 1 diabetes to continue to monitor their blood sugars immediately after delivery and in the weeks after their bodies recover. It's also important to select a pediatrician who is familiar with the needs of the baby born to moms with diabetes. A baby's pancreas after delivery needs a few days to self-regulate, so the blood sugars need careful monitoring. That's our Medical Minute today. I'm Robin Marsh.